Hello, my friends. So, Amazon, they are taking over the world slowly but surely, and they've taken a solid step right into the healthcare realm, which is kind of my realm. So, I felt I needed to discuss it, see what Amazon Clinic, that's what this service is called, see what it kind of offers. Is it legit? What I would use it for, what I would definitely not use it for. Okay. And just overall thoughts, right? Pros and cons immediately upon seeing that this existed, right? My husband sent this to me a few days ago. He's like, this exists. And my immediate reaction, which is always good, it was anger. I was like, I hate it. I hate it. He was like, why? I was like, I don't even know, but I just hate that it exists. I've now sort of stepped off that ledge, right? I decided to implement what they teach you in therapy, which is like when your immediate reaction is anger or rage or like frustration, explore that feeling. You know what we always do? So I was like, okay, Liz, explore why this makes you mad. We uncovered some things. We'll discuss them. And yes, and yeah, we do have a poll going. If you're watching live, hello, welcome. Come in. Let us know how you're feeling today. My day is going, it was going okay. It's taken a sharp nosedive. I won't lie. In the last 3 hours, some weird things have happened, and I'm like, what is my life with like other work? My real job, stressors. Anyway, let me know how your day's going. If you're watching on the replay crew, hello, welcome. But if you're here live, side tangent, you can vote in a poll of would you use Amazon Clinic, and you can vote in the chat too. The comment section. If you're watching later, let us know if you would use Amazon Clinic. I don't know. I'm torn. We'll see. I would maybe use it for some things. I think it can be great for things. We'll see. We'll see, won't we? All right. Well, here it is. Hello, M. Happy Punchki Day. So I was living in Michigan. I was told that this is pronounced Punchki, right? Patsky seems like it would also make sense. How do you pronounce this where you live? Here, they don't have punchkis. They have, oh gosh, something. It's Pennsylvania Dutch. It's from Amish people, and it is Fastnacht. That's what it is. They're like little donuts, basically. If you're not informed, my friends, you need to go out and find yourself a punchki. Okay, it's a donut, basically. It's a pastry donut, and it has like jelly or something good in the middle. Fastnacht here does not have anything in the middle, and it's not as good. Okay, I was kind of like, usually Amish pastries are very delicious, but here they are lacking the filling. We've gotten a lot of them in the last 2 weeks. I won't lie, from our local bakery. And without the filling, they're just not the best. It's Polish. There we go. M says punchki. Punchki. My pronunciation of these things is not good. But this word, you have to agree, this does not look like punchki. Looks like patchki or something like that. Anyway, Ileana, if you're not sure what that is, it's delicious. It's fried dough. Fried dough. Delicious. Renee's grandma used to make them. That sounds even better. Sandy Boffa, Amazon can't get things delivered to me properly. Trust them with my healthcare. Nope. So it may calm you to know, just initially straight off the bat, Amazon is not actually the one providing these services. Okay. So it is not Amazon itself. Amazon has contracted out. I actually was going to work for one of the companies that they are contracting out with. It's called SteadyMD, and the other one, we'll go through it. At least in most states, it's SteadyMD and then a different one depending on what state you live in. And that's kind of like a third-party telehealth company, right? I ended up not doing that because it was really regimented. It was kind of like, if someone says this, you do this. And after practicing for a few years, I was like, I can't be tied down by like, how when you first start in a job, you're like very guideline focused. And then the art of medicine kind of comes in. You're like, actually, like, I'd like to, within the bounds of the guidelines, like, play around a little, get a little bit messy, splash and see what you just find an art to it. They were not going to allow that. And I was like, hard pass. Also, telehealth, unsure. It just didn't seem fun. But so it's not actually Amazon, right? It is indeed, they're contracted out. So here we are. Here we have healthcare is a message away. Amazon Clinic. Have you guys heard of Amazon Clinic? Did you know this was a thing? I don't know if they're promoting it that much or if I'm just like so deeply into Amazon gardening that they just know not to offer me anything except for gardening supplies this time of year. They're spot on with those recommendations, gotta say. Everything else, No idea. But here we are. Healthcare is a message away. Get treatment for common concerns at your convenience. No appointment or video calls required. They are trending now. I didn't see that before. Trending right now are UTIs, pink eye, ED, sinusitis, and eyelash growth. If you have any of these problems, know that you are in vogue. There we go. So there's where no appointment needed. You can chat for a lot of it. It doesn't even seem like you need to actually do a FaceTime call. You can just chat, which is different than thing like doctor on demand, right? These are other ones, other third party telehealth companies. Doctor on demand requires you to like have a FaceTime chat. I'm familiar with that one because that's what my insurance requires. Yes, eyelash growth. We'll see. That is what they offer. It's one of their dermatologic things. We'll go over all of their offerings. It is personalized, they say. Your clinician will review your symptoms and prescribe treatment. But again, having worked inside some of these or having kind of discussed things with these companies, it is personalized, but it is not really, really personalized. One, because the appointments are so fast, right? In order to, we'll go through, but like in Pennsylvania where I live, it's $30 for an appointment. You're going to have to turn a lot of appointments to make that profitable for them. It's in order to pay you, right? So I'm assuming the appointments are very, very fast, and it's not truly personalized because you have to work within their very set algorithm. If they say this, if you think it is this, you must give this, and here's what you give for that. So that's not what I would consider like really actually personalized, which is where I'm reviewing your whole medical history. I know you for a while, right? As a primary care person, but so personalized, not sure. US licensed clinicians, great. Great. I don't know why we're questioning that. So this is for people in the United States. I would assume that it would be US medical people, right? We work with qualified doctors and nurse practitioners. I don't know if they work with PAs, which is interesting. So if you're a PA and let me know. Your health data is secure. That's great. All of your information is protected by our practices and by law. Good. I do have the creeping sensation in the back of my mind, though, of like, yes, they're partnered with these other companies who hold your health data, but does Amazon also like somehow own it? I have not read the fine print. I'm not sure. But the conspiracy part of my mind is like, Amazon probably knows way too much about me. And then who is Amazon going to sell it to? Or how are they going to use that, right? Here we are. Here is a list of all of the things you can get treated, right? And yeah, Mr. Moonwife, it's not personalized if you have to stick to an algorithm. Exactly. So exactly. If you don't have any way of, there's so many people who don't fit an algorithm, right? Guidelines are there. I say guidelines are there for general, like, showing you the general path, but there's lots of little detours that you can take off of these things. Guidelines are also great when you're brand new and you don't know enough to detour yet. Okay. And then when you get a little bit of confidence, you can be like, actually, I've seen these other things kind of work better. There's nuance to this, right? We go from there. Finding a treatment, right? So here are the things that we're treating. Okay. Pink eye, fair. Think it could be appropriate for that. Sinusitis. These are a lot of sort of almost like urgent care type things. Sinusitis. Sinusitis is like, that one's going to be interesting to me. I wonder, hopefully they're not just giving out a bunch of antibiotics for people who have coughed twice and have had like green boogers and, like a cold symptoms for a few days, because I feel like a lot of these people could end up getting antibiotics for things that are really just like viral sinusitis. You know what I mean? But everyone always wants an antibiotic. Hopefully they're not feeding into the whole overprescription of antibiotics for viral infections, right? Because if you didn't know, almost all sinusitis type things, colds, anything living up in your sinuses, you have to have it for like 10 days before it can become bacterial. Because what happens, right, is you have a viral infection that goes in your sinuses, and it lasts for 5 to 7 days. And then as it peaks and then it starts to like get better, the boogers and the germs love the boogers. They're like, this is warm and cozy and like nasty. I'm going to live here. That's when the bacterial infection starts. So then like you start to feel better from your cold. And then all of a sudden you're like given the ultimate plague. That's usually a bacterial sinus infection. They're very rare, but people get prescribed antibiotics for them all the time. So anyway, that's my feelings on that's my worry about sinusitis. Okay. I think in general, I wish we had better education. When I rule the world, that will be part of our health class in high school is like, please stop calling. Please don't think you have to come to my office when you've had a few days of this. People are horribly uninformed, and it's our fault, not their fault, that they don't know about sinusitis and how it's pretty much you never need an antibiotic. Cold sores, great. I think it's wonderful that for $30 in Pennsylvania, you can get treatment for your cold sore, or your genital herpes, for $30. Great. As long as you had a previous diagnosis. Wonderful. Quit smoking. Unsure how one appointment is going to get you to quit smoking. Like, because you wouldn't have the same person 2 times in a row. Would they give you are they going to be giving you like Chantix and being like, all right, friend, good luck? Don't know. Motion sickness, very fair. Would love to get something like if you just need, something for motion sickness. But now that I'm thinking about it, except for a scopolamine patch, what are you getting for motion sickness that you couldn't get over the counter? Maybe a scopolamine patch. Maybe that. COVID-19 test, positive test required. So in case you wanted, I guess, antivirals for it. Heartburn, acid reflux. This is where we start to get a little weird. Like I would like to, when people are coming in with heartburn and acid reflux, usually people have other symptoms and I'm just trying to rule out and make sure it's nothing scary or weird. But okay, I guess. And again, with this one, you can really just get everything over the counter that I would prescribe for you, through a prescription, except don't know. Don't know why you would go for this. And seasonal allergies. Great. Wonderful. If you would like medicine for your seasonal allergies, and again, you don't want to just get it at your pharmacy all by your lonesome, sure, go ahead. This one, then we have all sorts of things in sexual health, birth control, mixed thoughts on birth control, right? I am all for increasing access to birth control. I think we desperately need it. However, this makes me nervous that you can go and get birth control and we don't monitor it, right? Because if you were coming to me and I was prescribing to you, it has, it can make your blood pressure a little bit higher. Here you just have to kind of say yeah, I don't have a clotting disorder. What's the follow-up look like? I'm not sure there really is much follow-up because I'd want you to come back, right? And have a conversation about how is this working? Do you have any side effects? Can we tweak this for you? Has it affected your blood pressure? How is your mood after we've done that? We're going to have there's going to be a whole process here, not just here you go, have fun. But so that's on one side, right? Is that birth control and these types of things they have risks associated with them. And I'd love to just not send you out into the world. But on the other side, if this means you're going to get it when you otherwise wouldn't, bonus, right? So this is where we start to see things where I'm I hate it, but also this could be helpful. And I very much see this. And so that's where that's where I start to have thoughts. Big thoughts. They say you have to have a blood pressure that's lower than 160/90. How are you really checking it though? How are you really checking it? I think it's great that here, if you have got, some herpes going on, you can just call and be we've got an outbreak, we've got something brewing, and I will give it to you. Perfect. Excellent use of this app. Absolutely excellent. UTI, sure, whatever. Why not? Most UTIs, would it be lovely to have a urine sample? Sure, whatever. But you do you. Erectile dysfunction, sure, why not? You do you. This one bothers me. Yeast infections. You can't really diagnose that accurately without a pelvic exam. And I'm just really curious about how that's going to happen via a telehealth conversation. Okay. There's a lot that goes into those where you're hopefully doing a wet mount, with microscopy, you're looking at things under a microscope. And there's other things that it can be, right? Everyone always thinks they have yeast infections. Most of the time, in my experience, when people came in for that, it ended up being BV, bacterial vaginosis, or an STI or something like that. I would say maybe or other things like autoimmune diseases, or if you had dermatologic diseases that were affecting the area, or very different things, right? That yes, it's a yeast infection. you can get over-the-counter treatment for that, my friends, too. But it's hard. And they were saying on here that if you have more than 4 yeast infections in the last 12 months, you shouldn't use this. My dudes, if you've had more than 1 or 2, please go in and have it checked because it might be a strain that they'll do a swab of it, right? And they can even look under a microscope and see if it might be a different type other than the most common type of yeast infection it is. My dudes, please don't use this for that. Please go in and have someone assess the area and see it. Bunch of skin and nail and hair stuff, right? Sure, whatever. If you want your eyelashes to grow, sure, whatever. Male hair loss, don't care. Go, you do you. Acne, sure. I'm wondering what kind of medicine they do provide for acne. I'm assuming it's probably going to be things like aldactone, spironolactone, maybe for which can help because they don't do. Maybe they would give you like tretinoin, like the hardcore, like the step up from like Differin cream, because they aren't going to give you any controlled substance, which makes a whole lot. Eczema, rosacea, dandruff, I thought was weird. I'm like, I kind of want to look at your dandruff and see, there's a lot of reasons for dandruff. We'll go there. An athlete's foot. Sure. If you want to show me a picture of your foot, I'll give you some cream for that. So I think a lot of them are good. Here's where things get weird. Also, when we're done, I see in the chat, I think Mr. Midwife, you and I disagree strongly on some things about pap smears and birth control, but we'll save that for after so we don't get distracted. And disagreeing is fine, but I have big feelings. These are where things get weird, right? Are the prescription renewals. So my background is primary care, right? I'm a primary care nurse practitioner, and the fact that you can go and get medicine refills from other people, that's where I felt like I was personally affronted. Okay. I felt like you're taking my people away from me and giving them what they want without me being able to be a hen over them. So you can go and you can get refills for your blood pressure medicine. All you have to have is you have to have a previous prescription, right? You have to say that you have taken your blood pressure, which people are going to lie, right? You are not experiencing dizziness, headaches, anything like this. And you're not, nothing major has changed with your health history. I am torn on this, to be just blunt. I hate that you can go and get your medicine renewed somewhere else other than me. Because as your primary care person, right? If I'm giving you blood pressure medicine, I probably want to see you at a minimum every 6 months. When we're first doing it, I'll see you more so we can make sure it's working. You're not having weird side effects, things like that. But mostly, is it working? Make sure your kidneys are cool with this, right? But if you've been on it for a while, I'd just like to see you every 6 months to make sure everything is fine. Nothing new has come up. I would just like to check in on you because it is my license, right? My license with saying, I'm going to keep giving this to you. I think it's nice if you come in and check in with me and we can just have a nice quick chat, see how things are going. So I would love to not have my people go somewhere else where I'm not monitoring them. Cause then I'm like, what do you do? Show up in a year and a half. And I'm like, where have you gone? Where you be? Now all of a sudden you're back. But on the flip side of that, I have seen many, many, many patients not ever be able to come back when either their financial situation changes or they lose their job that had their insurance. And then they just no longer take the medicine at all, right? Or I've had people who would come back in 2 years later. And then all of a sudden they're like, yeah, I couldn't afford to come back because my high deductible plan means I have to pay out of pocket everything until we hit $8,000. And I couldn't afford the $100, $200 to come into the office to get my blood pressure medicine. That would be great for these people, right? This would be ideal for people who are like, I would love to keep taking my blood pressure medicine, but I literally cannot afford to go to my healthcare provider because of my high deductible plan, or I don't have insurance at all to get the renewal of my prescription, and they won't renew it because they, are demanding to see me, which is fair because you're like, well, that's my license. I can't just keep giving you meds if I don't see you. So it puts people in a real pickle. And so then they stop taking them. And I have had people then have heart attacks or strokes or other complications because they stopped medicine because they couldn't afford to come back so I could give them a refill. And it puts you in a really awkward position as a provider, because then you're like, well, I can't refill your meds if I don't see you, but I also don't want you to die. So unsure what we do here. I could see this filling that gap, but again, it puts a weird narrative outside of, like, it pulls everything away from primary care, right? Also, you can do this with cholesterol, exact same story. Hypothyroidism. Are you watching their labs? Like, some of these things are weird. Yeah, this is just US things. This entire thing only exists because the US healthcare system does not work and is built around making as much money as possible for people at the top. So this is really just a US problem. This would not exist anywhere else. This is weird. Um, Hypothyroidism, weird. Asthma, again, kind of weird. Like, I like to have conversations with my asthma patients and be like, how are we doing? How are our lungs? How are we breathing? How often are you using a rescue inhaler? Not that other people can't ask you that, but like, if the whole reason you have a primary care person is so they oversee the whole picture, and removing all of these little pieces through all of these different diagnoses gets pulled away, and then they don't oversee it. Uh, who's looking at your labs? What are we doing here? The thing that scared me here the most, though, was migraine. Okay. Like, I would really, as your primary care person, love to be in the know about your brain. Okay. I'd love to know how often you're having migraines, what your other symptoms are, like, how's it going, friend, with your brain? So yikes. I'm also just really offended about migraine, mostly because a lot of the times insurance won't even let me, as a primary care person, prescribe a lot of migraine medicine. But apparently, they're like, that's outside your scope. You need to go to a neurologist. But apparently, if Amazon does it, insurance, they can just do whatever. If you go around insurance, they can do whatever you want. So, because with this, right, with this Amazon clinic, it goes around your insurance, right? It doesn't, how much does it cost? So when I was typing it in, it depended on where you lived. I live in Pennsylvania. It costs $30 per visit, which is very reasonable, right? Compared to things like Doctor on Demand, which was, I think in Pennsylvania, I think it was like $85 when I was trying to compare it. So $30, very affordable. For reference, if you were to go in and do cash pay at most Pennsylvania, like where I live, it would be about 125. And if you were to go and have an office visit that was billed through your insurance, it would be about 175 for the lowest kind of possible complexity complaint, like what we would bill you for this type of an encounter. So it is very, very affordable. Again, that kind of goes back into, they're going to have to see a lot of people in order to meet their bottom line. It is not covered by insurance. Okay. So this is something you do outside of insurance, kind of as a, let me see if I can get this filled over, or like just done, and we won't even bother with insurance. You can ask your insurance to reimburse you. I don't know how successful people are with that. And yeah, it's available in 33 states. Mixed feelings, friends, mixed feelings when you go through. So let's kind of go through and see what it looks like. If you, can I just like say, I have pink eye, please tell me. So you go through, you pick your state. Like I said, there's 33 of them that they have. This is where it shows you the price immediately, which I like. So Health Tap, I've never heard of Health Tap. Gotta say, never heard. And then Steady MD, approximate wait time is like 2 hours. So this could be a really good option instead of like urgent care. This could be a really cool thing, I think, because if you were going to pay out of, depending on what your deductible is for some of these things, if it's an appropriate type of, thing that you're dealing with, could be a very, very affordable, very, very affordable, right, situation, depending on what you need. I love it for patient accessibility. I hate that this is taking another thing that's kind of taking away from primary care being able to like see the big picture of things. Hate that they're treating some of the things that they're treating, because some of the things that they're treating, I'm like, no, you shouldn't be doing that. That is not safe. What are you doing and why? But also, would I rather people go completely without care? No. We don't really have a choice in the middle here. So that's where we are. This exists. Would you use it? let me know. It's kind of don't know. It works for if you're in a pinch, I would say. Works in a pinch, but don't know. Annette Q said, what providers are putting on their necks on the line to prescribe this way? There's a lot of people who are doing telehealth because they are totally over it. Like I said, I looked into working at SteadyMD and got fairly along in the process before I realized it was very, very regimented. They don't really let you put your neck out on the line because of all of the regulations, right? They're kind of like, if this, give this. Very, very, very cover your ass medicine happening here, which is why I'm worried about these types of things going and being like, everyone gets antibiotics, right? I think this leads to, I would imagine, a lot of over prescribing because you just want to cover your ass, right? You want to make sure that, well, I can't really see it. I can't touch it, right? So let's just do this. But that's telehealth in general, right? If you are telehealth and a lot of things are moving that way because it's very convenient for patients. Again, we come down to an accessibility thing. If you're not going to receive care at all, I'd rather you just do a telehealth appointment than not do anything, right? Which is better, but it's always helpful to like look at people and be able to have them in front of you. So we run into the issue there. D Squad said this might be the beginning of introducing AI primary care to the masses. We all know that it's coming. Just do the best where you are. Yeah. I was thinking, so when I was going down my rabbit hole of like, oh, I hate this. And then trying to like the rational other part of my brain being like, Liz, this is increasing access to care. You like that. It's not how you want it to be, but like, they're trying to do what they're in it to make money. They're not trying to be altruistic, but like, I was trying to give them the benefit of the doubt. I was imagining that I think something like this will start to become I think Amazon and these companies are going to start to do primary care. I think they're probably going to open, now this is just me like speculating, clinics where you could kind of go in and there's not necessarily even like a nurse practitioner or anyone there, but you would go in, you would get your lab work done, you would get your vitals taken kind of as like the in-person assessment of things, like just the bare minimum. And then you would have an online appointment and they would have data to back up what they just did, basically. So you can have your appointment whenever, as long as you stop into one of these satellite places, kind of get a baseline of what your blood pressure really is. They could grab some lab values on you really quick and on your merry way they go. That's what I think is going to start to happen. I would not be surprised at all too if they started having some kind of like in-person like pop-up clinics, right? These, I think we're going to start to see more and more of these very, very regimented, if you say this is what happens, very very, very managed care type situations, run for a cheaper price, right? Just kind of going around insurance entirely because, right, we see a lot of people who can't afford to use the insurance that they pay for because the deductible is $8,000. And people are like, I don't have enough money to go to the doctor to reach that $8,000 before insurance kicks in. So I think places like this are going to start popping up where it's like the budget version. You have, appointments are already short. I feel like this will be even shorter. It'll just be kind of like robotic, which makes me sad because that is the last thing that your primary care should be, is robotic. And I think that's kind of what all of this is going to. Tamara says, sometimes it's hard enough to get all the information in an inpatient appointment. If it's a new concern, better to be seen in the office. Yeah. And a lot of these places don't seem like they want to do first encounters, right? They kind of want to take someone who's been on blood pressure medicine for a while and needs a refill. They're offering a very convenient solution to them having to come and go to their primary care's office for a refill. They're like, hey, you just pay us $30, which is cheaper than your primary care's office. We won't ask you all the annoying questions that your PCP probably would to make sure like things are fine. How is everything going? You can do it via a text message basically, and we'll refill your meds. Bam. So I think they're offering convenience over everything else. So that's yikes. I fear for the way that healthcare is going, that we're like trying all these workarounds to try to get oh, let's see what like budget weird option we can get over here. But if it increases access, right, we're going to try to hold on to that hope. Let's see, I'm going to go look at our poll. 68% of you said that you would not use it. Let me know why you would or you wouldn't. I could see myself using this, honestly, as for like very basic things, right? If I wasn't sure. Sorry, I was listening. There's like a really weird noise outside my house. If I wasn't sure, if I didn't have a medical background and I was like, I don't know if like I just want someone to take a peek at this really quick, I could see using that. Since my poor children have a nurse as a mother, I'm like, you don't need anything. You're going to be fine. Your body's going to fight it off. Everything's fine. So I probably wouldn't use it for that. But I could see how that would be a very, very affordable and approach a good option that would be very easy. Jazzy says for simple refills, yes, I would. See, that's what I fear that most people will do. Nothing like against your choice to do that. But then it just takes that conversation away from primary care and you lose more of the big picture. Yikes. Renee says, if I'm in a pinch, like away for vacation or just going to get my driver, it's better than a 300 ER visit or 150 for urgent care. Absolutely. So this is where I think it can really like shine, right? If people are in pinches like this, excellent. $30, very affordable considering what you can get, right? There we go. Natalie D says it looks like it might be good for urgent care kind of things like pink eye or bronchitis. Yes. But basically I wouldn't use it for anything else. Yes. Pink eye. But even then with pink eye, it's my paranoia though that I think is setting in because then I'm like, how am I going to be able to do a vision assessment on you and make sure that your vision's like fine and that your pupils are doing what they're supposed to do? Like da da da. What are we doing there? JB says Amazon Clinic. Can I get discount with Prime? You can on their pharmacy. So they do. Amazon apparently has a pharmacy, and you can get like a pharmacy subscription through Amazon. And if you are a Prime member, you get a discount. So there you are. There you are. Maybe when Amazon takes over and they have like a whole primary care, when they take over the healthcare world, maybe if we have Amazon Prime, then we'll get a discount. But they're my thoughts. Mostly, I hate it. I'm glad for the subset of things that it does do. I'm glad it exists and it is serving a population that probably does desperately just need it. And a large reason of why I hate it is that the system is so broken and stupid that it like this is meeting a need that is there. And I'm just really angry that that gap is there, that people can't just, be able to afford to go to their healthcare provider to renew medicine. I mean, it's going to be interesting for me to see. One thing I'm watching is like, are they going to start renewing psych meds? So like things like Zoloft. Will you, if you already have a prescription for something like that, will you be able to come in and get those meds? Right now, I haven't seen any psych meds on this list. And that seems like a hole to me. If we're prescribing the other things, I have had a lot of people who have gone off of their psych meds because they couldn't afford the appointment to come in and see me. And I have in the past gone off of Zoloft because I could not afford the appointment to go in and see my healthcare provider. So I just stopped. So I would love to see them maybe going in that appointment, like that direction. I feel like that opens them up to a lot more liability because mental health is much less check the box, give them the thing, move on than other things, which are very like, oh, you have acid reflux. May I encourage you to please try a Pepcid or a omeprazole. Please take one of these. Okay, perfect. Goodbye. You know what I mean? Yeah, Jazziner says psych meds. No, I see a slippery slope. Yeah. And that is a slippery slope, but it also feels disadvantageous. It's a big word. I don't know if I use that correctly. It feels mean to not have it because a lot of people need those and they don't have them. You know what I mean? I don't think they have not, it looks like, dove into prescribing things for like starting anybody on anything that they're not already on unless it's a very urgent carry type of thing. But who knows? Who knows? Who knows? Yeah. Band-Aid on a hemorrhage. That is what we are looking at right now. Yikes. Yeah. I hate it. I hate the fact that Brittany Young says, I hate it. I hate the fact that it needs to exist in the first place more. That sums it up very well. Too long, didn't read. Whole video. There we go. Mr. Midwife, how do you prove you already have a prescription or something? You have to upload a video, like a picture. So if you were to go through it, you could be like, hey, let's try it. Should we try saying that I need more blood pressure medicine? Let's say, I thought eyelash growth was so funny. Like for all the things, they were like, yeah, sure, eyelash growth, sure, whatever. High blood pressure. So if I say I have high blood pressure, if you have a prescription, personalized treatment plans include prescription renewal for a high blood pressure medicine that's worked well for you in the past 6 months. Your clinician won't prescribe new medicine or change doses. They won't order lab testing. You can message your clinician for 14 days afterwards. Oh, here. What you'll need. A photo or screenshot of your most recent prescription or the name and phone number of a U.S. pharmacy where we can verify your prescription. So there you go. I wonder if you could just take a picture of like your pill bottle or something. You need a photo or screenshot of a kidney function test from the last 12 months if you need more than a 30-day supply of your medicine. So that would be something that if you were going into your primary care, they would order at least every 12 months, if not 6. I usually just did every 12 if you were stable. So most people would have that. A blood pressure reading from the last 30 days. I mean, where are you going to get that? Right? If you don't have a blood pressure cuff at home, a heart rate reading, people probably just lie about their blood pressure. They did all the time. All the time for me. I'm like, you would ask them, do you check your blood pressure at home ever? Or like stop into Target and get it taken in one of those things? They're like, oh yeah. They're like, tell me what it was. I'm like, are you lying? And they're like, yeah. How did you know? I was like, I just figured. Everyone lies about that. Some people really do. And then it was like the people who did that had a immaculately detailed log. And it was like January 4th, 3:37 p.m. after 1 cup of coffee and a walk halfway around my block. It was this. And then they'll like mail it to you. It's like broken down 7 times a day. I'm like, wow. Wow. Adrienne, we're discussing Amazon now having healthcare. Yay. What thoughts? A photo ID of a driver's license, and you need 5 to 10 minutes to answer questions about your symptoms and health history. So there you go. 5 minutes, 5-minute appointment. Boop, boop, boop. There we go. Yes. Local grocery stores, in case you needed to know, do have free blood pressure checks offered. This is what I always told my people. I was like, whenever you're in the store, but make sure if you hate shopping, like just calm down for a moment, right? Just go and sit for a second. Because if you're like me, you hate grocery shopping, or if you're out of like shape or you're chasing children, just your blood pressure is going to be sky high just from walking and getting into the store out of the parking lot after wrestling people, dealing with whoever's trying to kill you in the parking lot. Just sit for a minute. But this was the best because most people do go out to a store at some point and you can get them. That's how I got most of my people to go and get their blood pressure. Was it one of these little things? So those exist. They're excellent. There we go. The questions keep Amazon from being liable. Yep. And they keep those other companies that are hosting it from being liable too. And, they have their own little questionnaires that they have. Yeah. 5 minutes. Wow. So glad that you can get 6 months of your blood pressure medicine after a 5-minute. Like, yeah, I'm sure you're fine. I'm sure it's fine. US health comes are already bad enough. This Amazon service isn't going to help unless they're helping people get their blood pressure meds who otherwise would have like disappeared out of my world because they're like, I just couldn't afford it. So I stopped for 3 years. Then I had a heart attack and they told me I had to come back. Literally had people who did that. They're like, well, I had a stroke. I'm like, what? Where did you go? They're like, well, I couldn't afford to come back and see you to get my blood pressure medicine. So I stopped. And then I had a stroke. And then the hospital told me I had to come back here. I'm like, wow. Okay. America. America. Here we go. Amazon would absolutely not be good for patients, nor workers. Yeah. And again, it's not Amazon. They're outsourcing it to these other companies, these telehealth companies that are doing it. And it's very, very regimented. So there's no personalization really. Healthcare is quickly becoming a hedge fund owned industry. Yeah. And this, like I said, I think is going to be like the discount version of healthcare where you can go and get things for cheaper, for much less time, much less personalization. But if you just need access to it and you either can't afford insurance or have too high of a deductible to actually use the insurance you pay for, this might be for you. So yeah, that's what you have to do. That's what you have to do. Can I get my kidney function test through Amazon? No. Kidney function test is not available through Amazon at Clinic at this time. I told you, I didn't even read that part yet. At this time. They're definitely planning something. 1,000%. 1,000%. Who can use this? People between the ages of 18 and 64 in a US state that is on the list. There we go. Do I need to make blah, 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 blah? Is it offered in my state? Where are the clinicians located? In the US, you have to be licensed in the state that you're practicing in. So you can be licensed in a bunch of states. So when I was doing this, like I held a North Carolina and a Pennsylvania license, and they wanted me to get, oh gosh, I think like New York and something else. There were other states that like SteadyMD wanted me to get. And that was another thing where I was like, that is way too much work because they were not going to do it for me. And I was like, no. I won't be doing that. Let's not do this. How do you ensure clinician quality? Before online clinics join the Amazon client storefront, we rigorously evaluate them for overall quality. Once an online clinic has joined the storefront, Amazon Clinic works with them to ensure all of their clinicians continue to meet applicable standards of care. There we go. So I don't know how rigorous the process is, but I bet it's not wild. I bet it's not here. Not too crazy. There we go. Here's all the things that you need. Thoughts. Yeah. Clear off a conveyor belt in the warehouse. We'll take your appendix out right here. That's the vibe it gives. Yeah. So if you're 65 years and older, they don't want to do this. I'm sure there's some, they're liable things there where they're like, that's where we start to like outcome, you get older, things aren't working quite, your kidneys aren't doing the things. Also, that's when Medicare kicks in, right? So people are probably less likely to want to need to use something like this because if you have Medicare, and I don't know, you might be able to get into your office for cheaper. Don't know. Not yet CMS approved. It's just a matter of time. Yeah. So, and Medicare is also part of like CMS. They just don't do insurance at all at this point with Amazon. So, and a lot of times people like once they have Medicare, they really want to use it. And then they want to like people who use Medicare. They really fight you on a lot of, which is totally fair. Our health, it's so stupidly expensive, but they really, they will come back and like, those were the people you were always had on the phone when you were like nickel and diming you about like, you're like, yes, you have a $10 copay with your Medicare. And they're like, well, I don't think I should. I'm like, I don't know what to tell you. Like, that is literally just what your policy says. Like, and you're like, do you not have $10? Like, maybe we could like try to work with you or something. They're like, I just don't think it should be that. Like, okay, I don't really know what to tell you. So they might just not want to deal with people. That might be their cutoff. They're like, no, we're just not going to do that. We're not going to do that. We're not going to do it. Also, having worked with a lot of, and I'm making a lot of generalizations. And if you are an outlier in this category, this is not a targeted attack against you. Okay. I just think they probably also don't want to deal with people who are 65 and older. I mean, 65, a lot of people can handle it, but the telehealth population, I'm telling you, having been a nurse practitioner in primary care during COVID, when I had to try to when I had to figure out myself and then teach all of my patients how to do telehealth, the number of encounters I had with like cameras, if they got them turned on, like facing the wall or something else, you were just like, what am I seeing? What is happening here? And the amount of technical assistance I had to provide because there was no technical person at my office other than me. That's where we were. So that's what we've got here. That's what we got. Pinchik, I just got into nursing school. What did I get myself into? Well, congratulations. Getting in is very difficult. You might want to abandon this channel now. Keep your spirits up. Everything's going to be totally fine. We need you in healthcare, but also stand your ground. Don't let people take advantage of you. Don't do it. I believe Nina says, I believe if a patient is over 65 and they want self pay services, they have to see a provider who has specifically opted out of Medicare, like my office, because if you aren't as a provider opted out of Medicare, you're required to bill Medicare. Oh, that's interesting for services providers. So, guess that has something to do with it. That's interesting. So, we took Medicare, so I don't know anything about that, but that would make sense that if you get care, you have to be billed for it through Medicare. I could see it. Yeah, Costco, Adrian. I think Costco is probably Costco is probably looking at this. You know, who else? I'm trying to think of the giants. The first word that came, like one that came in my head was Netflix. I'm like, no, Liz, Netflix is probably not. Netflix is probably not doing this. And then what would they possibly do with that? That's, I don't know. Your video footage, we've compiled all of these different people with their athlete's foot. You can come watch it now on Netflix. That's a fun thing. And Nerali just got 2 A's on exams today. Can do hard things. Yeah. Get it. That's awesome. As someone who never got A's, I am always impressed, just blown away by the fact that people do. It's amazing. Mrs. Melanated said, Miss Melanated said, my PCP still wants to see me every 6 months. She has a copy of my home visits. Yes, I like to see people like every 6 months. Just, unless you were, just had nothing absolutely going on. I was like, just come see me every 6 months, just so I know you're okay. Check in. Things are fine. Everything's okay. Okay, here we go. I heard Walmart is opening clinics. That also does not surprise me. Probably a very similar vibe to the Amazon thing where it's like very regimented, like you see in minute clinics in CVS. These are going to, I think CVS does go through insurance though, which is different. I wonder if Walmart will. CVS, I think, has like rates, it's like a menu. You can also go without insurance and kind of find like what's going to be the most affordable. Things like this are going to just keep popping up, right? As we don't have people who are able to go to their healthcare provider. Also, we are having all the healthcare people like being like, peace, this sucks, bye, and leaving and going out. So there's nowhere to have an appointment with, right? Like where we live right now, there are no pediatricians, like there are none in our area. So we then had to our kids see a regular family medicine doctor, but even then there's barely any family medicine doctor. So trying to find them a pediatrician was like painful. It was like a 7-month wait for them to get in. And then it was a family medicine person. And we have some medical complexities in them. And so the office was trying to refuse them. I'm like, you're literally the only people taking patients within this huge radius of us. And they kept saying, no, they have this, they need a pediatrician. And then it was fighting back. They were like, but there are no pediatricians. So there's that. There's that on top of everything. I do live in a more rural area. So things get weird, but also everyone's quitting. Everyone is over it and leaving. I don't know if you've tried to find primary care or healthcare in general recently, any of you, but it sucks. There is no, even when I expanded my search because we live within an hour of Philadelphia, within half an hour of major Philadelphia suburbs, right? And there was still nobody. Yeah, the reason we got them in with someone who, it always sounds bad. Mr. Murdoch said, just have your kids see an FMP. Wait, you could do it. We ended up going with someone who is they do see a nurse practitioner who was very uncomfortable seeing children. They came right out and said it. They're like, I don't feel comfortable seeing children. They're making the office is literally making me. So I did kind of tell them, I was like, look, we're not going to be here a lot. Okay. We're not. I really live by but are you dead? But did you die methodology with my poor children? And here we go. You won't be seeing them a lot. If you do, it'll be really severe, which in that case, I'll probably just take them right to the ER. So we'll see you once a year for our physicals. Please and thank you. We might need some asthma medicine, in which case I will tell you exactly what I want. Okay. Which either makes me the nightmare parent or patient, parent of a child in your care. In this case, the person was just absolutely petrified. I felt so bad. It was a new grad nurse practitioner who did not want to see children. This office was like, you must. And then on paper, my children look scarier than they are in real life. So that's what we got. How soon we'll be able to DoorDash our healthcare? I don't know, like 9 months. I feel like that's with all the telehealth. We already do that. Yeah. Yeah. So things are either going this way. If you have money, things are going into concierge medicine. There's a ton of concierge practices around us. We can't afford those, but that's where we've done an episode on those. I like the idea, right? Where you just have kind of like, you take a smaller number of patients pay per month or year, kind of like a subscription to you as a healthcare provider. And then you don't go with insurance at all. And then they make deals with like lab companies and radiology offices to get you discounted rates on things like imaging and stuff. Like that, like the approach of those, that they're obviously trying to just provide holistic care to people, but struggle with the fact that that is not an option for most people, right? We have a whole equity thing here where it's like, if you aren't making the bucks, then you're going to probably struggle. J. Michael, hello. I hope you're feeling okay. And hanging in there. But yeah, that's where we are. My cousin is an F&P in California. She does concierge. Yeah. Concierge looks very appealing. And if I was not, I just don't know if I can, like, concierge makes me feel so bad for the people who can't afford it. Right. And I think everyone deserves access to like healthcare. That's good. And I feel sad for people who then can't afford it. Oh, here we are. So that's Amazon. Those are my thoughts. Mr. Midwife, I was going to talk about forever ago. Now it's tangent time. So if you were just here for Amazon, you probably already left a while ago because we have veered sharply away from that. Oh, Irene, I can totally relate. I totally didn't realize my coughing toddler had pneumonia. I feel like that would be me. I feel like you're totally fine. You're going to get over this. Everything's great. Here we go. Oops. So you had a spot of pneumonia. That will be me. I will also be the parent. I'm like, why are you being lazy? Just get out of bed. Oh, turns out you have, what's the one? Oh gosh, my brain, where like you like literally just like can't get out of bed because you're exhausted and your body's like attacking you. It's like a real disease. Can't think of it now, but it's probably not a good story to tell if you can't think of the actual. It's kissing disease. What's the real name? Someone tell me. Anyway, yeah, I've been waiting for the tangents for 20 minutes. Raise your hand if you're only here for the tangents. Will, yes, mono. Mono, that's the one. My poor sister. So I love my mom's the best. I love my mom, but I'm going to tell a story about my mom. My mom is a nurse, right? So we had nurse raising where you were like, no, you are fine. Get up out of bed. You'll be fine. Yeah. Sister was really tired. My mom was like, you're so lazy. Get out of bed. Just stop being tired. Yeah. Girl had mono. For like a while, she like went in, it had turned like she had mono and then something else got piled on top of it. And the person's like, oh, well, it's probably not helpful that you also have mono. Mom's like, oh, that will 1,000% be me. And I'll be like, get up out of bed. Come on. Let's go. Here we go. Oh, it'll be fine. Yeah. Have you tried being fine? Oh, that will 1,000% be me. Unless you can't breathe, take some Tylenol. I know. Oh, me. Also very much me. I feel a pulse. Get to school. My neighbors, I feel so bad. So my neighbors they're so good about keeping their children like home. Whereas I'm like, okay, like you don't have a fever. I don't think you're not contagious. You can slap a mask on your face, cough into your elbow, and away you go. They're like, well, they were coughing a little bit, so I just didn't, maybe nervous. So I kept them at home. They said, they had a little bit of a headache. So there we are. I'm like, drink some water, slap that mask on your face, cough into your elbow. Let's go. Out the door, ma'am. Oop, Oops, sorry. So sorry. But are you dead? Yes. No. Yeah, we did have to be very, very ill. But I will give her credit, my mother credit. So we had to be on death's door in order not to go to school, but we did get mental health days that were optional. Like if you were just going through it, and they got more frequent, the better you were doing in school, and the older we kind of got. So she would give us like you would have to go to school with your walking pneumonia. Having done that, we would go to school with a lot of these ailments. However, if you needed like a mental just a day off, my mom was like, "Yeah, that's legit. That's fine. You don't have to go." I understand that. So she respected mental health. I appreciate that about you, mom. Uh, yeah, my mom was a nurse too. You should have seen me as a school nurse go back to class. My mom was the school nurse. So when my sister and I, for a few years, our mom, she was the school nurse. I did not get treated like the other people that walked into that office. I'm like, Mom, I have a headache. There was a cot, like, I think I need to lay down. She's like, drink more water, go back to class. You just hate history. That's what it is. Go back. It's like, oh. Everyone else like, your mom is so nice. When I go in there, she like tucks me up in my cot and I get to sit in there and like, she's so like relaxing when she's talking to me. I'm like, oh, is that what it's like? Is that what it's like? Oh, yes. So my kids hate that I use the correct words for things, the joys of having a nurse as a mom. My neighbors probably also hate this because we use very anatomically correct terms and everything is explained. The other day, they're like, how are babies born? I'm like, let me tell you, there's options. Okay. First of all, I need you to know there's options. Okay. And second of all, here we go. Here's the whole process. My neighbor's children they're all kind of in the same age. And then my children, of course, go and talk to them and say all of these things. You're like, what? They're like, your children might learn some new words. Okay. We don't beat around the bush here. We're very direct. So my daughter might walk you through the process of a C-section and how messy it is, or a vaginal birth. So I'm just going to warn you about that. Good luck. There you go. She did ask if anything breaks when the baby comes out. And I told her that, yes, in fact, you can do some damage. And so you might have an interesting conversation at the dinner table tonight. Also in defense of my mother, she's not stone cold. She's a great, wonderful woman. She just saw right through our antics. When we were truly sick, she was excellent. Right. And she was very excellent at talking me off of my very many mental health days when I was sure, that everything was going to fall apart. But I'm telling you that when you were sick, she did a great job. She had that little ship running. We had it was the best. I probably would be. Oh, I probably would be that person who that's how everyone's going to know everything. They're like, go ask their mom. She'll just tell you like it is. Zero fear. Oh, yes. Insert the corpus callosum and corpus spongiosum intravaginally upon the release. Well, that is how that will go. No, so far, we've navigated around those conversations not around, but like that direct, very simple questions have been asked about how babies do come to exist. Very simple answers that are honest, but leave a lot. We've managed that. We do that. So, anyway, back 12 tangents ago, Mr. Midwife was talking about, so one of the things I was like with birth control, when you're getting it through these websites and stuff, right? One, it's just like it's dangerous. It carries risks with it, right? It's not like dangerous, but it's a med that I would like to see you after I give it to you to make sure things are fine, right? And so I think you said, and correct me if I'm wrong, that you want them to come in and get a pap smear. And that is something I feel passionately, weirdly against, actually. And you can let me know, you guys, in the comments. Because I've had a lot of people that don't want a pap smear, but do want birth control. And I'm not going to hold back birth control. I don't like to hold back birth control from people who they want birth control for whatever reason that like they want it, they have a right to it, but they might not, as long as they know the risks of not having a pap smear, right? The two are not, like I'll give it to you, right? I would rather you not have a baby. I would rather you not, if that's what we're up against, I would rather you be able to get the, if you're trying to control like crazy heavy periods, I will give it to people. I got a lot of patients who would come in because they couldn't get birth control because they were being told you have to have a pap smear, and they were either terrified of what that was, or they just had like trauma in their past and they did not want one, or they were really uncomfortable. And so I just felt like you deserved to have it, whether or not you had a pap smear. Like I would have the conversation with them about like, yes, I think you should go on and get one. This is why we do them. But holding that over, I didn't like holding that over their head in that way. And so that's just thoughts on that. So if you so this is a way to get around that. I think too, for a lot of people who do want birth control, but might have that as like a barrier, right? And I totally get why you do it. Like having people come in and get, like, it's important. It's an important part of primary care. And ideally everyone, who needs a pap smear would be getting one. And then you can talk, about like screening, education, and STI testing for sure. And in my ideal perfect world, right, I would love that. It just, a lot of times people then like wouldn't come in and then they would get pregnant. And I'm like, oh, I just wish we had this. And my way is certainly not like the best way. So feel free to discuss in the comments. We can all have it, done we all can have our own opinions on that. That's just mine. Mr. Murdo said I don't hold it over their head, but I see a lot of ascus and so forth. Ascus is like one of the precancerous markers on your cervix. And I totally get it. Like I do, like you can find a lot of things just through doing those. And I'm obviously 100% pro pap smear. The thing that would annoy me was when people would come in and they would be like, oh, I couldn't even, I don't want to get a pap smear for whatever reason. And I was like, okay, I mean, like ultimately that's your choice, right? And then they couldn't get birth control because they wouldn't get a pap smear. And I was like, oh my gosh, so many just lead to a million other complications. And that was my convoke self-swab for HPV at least. I think right, like, I mean, that I have had people who I'm honestly not sure of like what the self-swab kits, like the accuracy, because pretty much everybody who we had the conversation with eventually did decide they were going to do some type of like, not even if it wasn't that day, like come back. And I think we ended up doing pap smears on pretty much everybody, through like, just forming a relationship with people, showing them. I used to show all my people like, hey, this is what a speculum is. This is what this is. Like, let's talk our way through it. Like there was a lot of different things you can mitigate a lot of, if someone's had like trauma with that, there's a lot of things you can implement to make it like less overwhelming. You know what I mean? Mr. Midwife, who is the authority on this, says no. So no, no self-swabbing. I really don't know anything about, I think I've seen things for like self-swabbing for that. I don't know I have not kept up since, I probably should look it up, since leaving clinical practice. I haven't kept up on, that was just coming out when I left, to see like, is there how accurate is that for catching abnormalities? Because essentially what you would be doing is going up and swabbing like your cervix yourself, if you can find it, I guess. I don't know. Like I said, don't know. I would need to look into that more. But that's what we see. I see swab, and I had to see and swab the correct structures. Yeah. So you do need, like, that's why I think it's hard, because like you might not hit your actual cervix, and then are you missing it? You might think you don't have it, but you didn't even get up onto your cervix. You know what I mean? And you wouldn't have the little scrapey thing to go in and get there. I'll have to look into it, and then I will update you. Is an HPV a blood test? You would come back on a, can you get it through a blood test? Now I'm trying to think. I usually saw it just through, how did HPV come back? I think on the pap smear, right? In your cervix? I don't know. We're branching very hard over into, yeah, it came back on the pap smear. Yeah. Because you would test it, you would send it, and you would ask it to come back with that. So don't know. Long story short, don't know. But there we go. Don't even remember how we got on that tangent. Not shocked. Nina says, I've only seen them through PAPs. Yeah, me too. I'm like, have I ever seen it through a blood test? I don't even know. I think I've only ever seen it when it comes back on your report for that. And he says, sort of off topic, but Mr. Midwife, oh, do you offer, okay. Do you offer pain management for office gynecologic procedures like colposcopies and IUDs insertions when we do them at the office? We do not, but I am wanting to. I mean, other countries, you get some good stuff for that, right? Yes, HPV on PAP. Okay, good. I was like, am I losing my mind? I thought it was only on that. Yeah. In other countries, it's like those are like whole procedures where you're like either put under or given like really good drugs because those really hurt. Unless you're having your IUD put in by someone who really knows what they're doing right after you have a baby when everything's still like loosey goosey. Then it really hurts. I have had an IUD put in by, I've had IUDs put in. I've put an IUD in people only in school. I didn't put IUDs in people in outpatient because I didn't do them enough and I didn't want to hurt people because that wasn't what I did every day. I was like, having had an IUD put in by someone who didn't do it every day, I don't want to do this to you at all. Let me have someone who this is like their Tuesday versus me being like, I've done that once. You should get pain management because other countries, like, of course. Could you imagine if this was done to like dudes, if we were doing, or like, who does the research, who implement, like, I feel like when this was all researched and we were coming out with it, they were like, no, women will be fine. They'll be totally fine. Don't even give them numbing anything. They'll suck it up. Whatever. I would love to see that change in our lifetime, friends, that we give people some pain management, appropriate pain management for IUDs, colposcopies, all of the things. Nurse Scott, but you need to learn gynecologic topics, Nurse Scott, right? Didn't you say you had these coming up? Oh, here we are. You need to learn this stuff for clinical, okay? You have to learn to catch people who are going to be fainting because it hurts. Good. Renee said at the gyne office, I did my clinical and we did some pain management for procedures. The people I did, so at my office, I didn't do procedures, right? I did pap smears. But if you needed anything above a pap smear, no, you were going to go to someone who does reproductive health. But the person that I did my clinical with for reproductive, was with a midwife, and that she was brilliant, absolutely brilliant, but also was not a huge fan of the pain meds. She was like, that'll be totally fine. It'll be totally fine. Yikes. Horrifying things. She was, colposcopies, all of that. Yikes. Okay. All right, friends. Well, as always, we end with some good old reproductive health and how not to give all the things. Love some good pain medicine. That's why we love you. That's why we love Mr. Midwife, because he cares. There we go. All right, friends. Well, this has been a delight. Unsure. Hate that we need this is the final call on the Amazon clinic thing. Hate that we need it, but here we are. We need to fix things. Hopefully soon. I really need to get the energy to go out and start practicing again. I've had I feel like I abandoned everyone by leaving, not everyone, but I feel like I'm not using my degree when there's such a shortage of people who need primary care in my area. We've moved onto the section where I just, have my midlife crisis with all of you. I feel like I really need to go back out so that we can fight things like this, but I'm not really fighting it because people still can't access care if they can't afford it. But also it would help if they had someone in their area who, didn't decide that it stole their soul and they quit. So don't know. That's what I'm considering now is, do I want to go back? Do I want to go back? Not really, but sort of. I do miss little bits of it. I'm like, I miss patients. But, I don't think there's the solution here is political. The solution here is getting it so that, everyone has access to healthcare. That's not real. So it wouldn't be like part of the solution if I went back. And I also just don't know if it made me so sad. It made me so sad when people couldn't afford anything that they needed. And like my brain right now is like, it would be fine, Liz. It would be fine. You'd be able to handle it. And now I'm like, I don't know. I don't want to do urgent care. Don't like urgent care. I like the long-term relationship with people. I hated acute visits when people are sick. I was like, no, don't be sick. This is not what I like. I like educating on like, all of the long-term things, blah, 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 blah. I felt like urgent care, not my jam. I like getting to know people. You know what I mean? I liked that aspect of it. Urgent care is great for a lot of people who are super burned out because, yeah, they're just like, oh, well, I can just like see you, be done, and go on. But that's like not why I went into it at all. But really, COVID also, and I also like, I'm working in it. I would be working in a different state. So that plays into it, right? So I think that would be a little bit different. And when it's not it's not like COVID, right? You know what I mean? So a huge reason another big reason that I left was everyone was coming and threatening to bring their shotgun in and show me what's what, because I wouldn't write them exemptions for, for like vaccine, like, or like write them a note so they don't have to wear a mask. And I was like, oh my gosh, we're in the middle of a pandemic. And that was unfortunate. So don't know. But is it actually helping when you're burned out and hate it? That's my thing. I'm like, how quickly would I go back immediately to just having like, I can't handle this system and and the stress of not being able to offload patients, right? Because there's a huge stress of when your patient needs to go to a cardiologist and they can't afford to. So now you're managing a complex heart failure patient on your own because they can't afford to go to the cardiologist, and then they die, and the family's coming after you, having had that happen to me, even though you've had them sign all the things that say, I know I need to go to I know I need to go to a specialist, but I can't afford it. But the family is still going to come back and be like, hey, you should have done this differently. And you're like, well, I'm not a cardiologist. So I tried my best. We did this. And I felt like most of my job was workarounds in primary care of, how am I going to make this work with what we have? And that is soul sucking. Let me tell you, that is soul sucking really quickly because you're watching people die of things that they don't need to die of. You know what I mean? And you're good at compartmentalizing, Scott, and saying, I can give the best patient care in a broken system. You're good at that. I think it's just all compounded, really, of seeing it over and over and over and over and over again. You know what I mean? So who knows? Anyway, well, that got existential quickly. There we go. Thanks for being here, friends. Sandy, thanks for the kind words. You're helping solve the problem by having a place for these discussions. Very few places where these things are discussed openly, and you do help all. Thank you. That's very kind. But there we go. That's our existential chat for today. Let me know if it really is like provider PTSD. Like it feels like it's maybe like, yeah, it's not fun. Oh, Jason, thanks for the super sticker. That's super kind. I appreciate you. I'm gonna switch over to YouTube to see what it is. And J. Michael gifted 5 memberships. Thanks, J. Michael. That was super sweet. That might have been a while ago, and I just saw it because StreamYard didn't tell me. That was really nice. Thanks, J. Michael. It's a cute like duck quacking. Oh, thanks. I appreciate you, friends. Thanks for picking me up off of my pet talk as I figure out what I'm doing with my life. Nina said, did your office have them sign an actual form stating they understand they needed a specialist and documented in their chart? So I did that because the person I worked with didn't. She trusted them to not. She was very, very trusting of the people, like that. She very much. It was her own practice. It was just her and me. And she opened her practice because she hated the way that everything was like, you had such small appointment times and like yada, yada, yada. And so she opened her own practice so that she could like do things how she wanted. But she really trusted her patients. And I had seen that I was just way more cynical, way more cynical than her. And so I didn't trust that. And so and eventually after some other things happened, she ended up adopting. I had uh, kind of like Googled document, which is probably not the most legal way, but found a document that I kind of tailored to literally say, and I had to use it all the time, saying like, I require a higher level of care than I acknowledge that I require a higher level of care than this person, my name can provide. Now, please do like go and get a lawyer if you want to like make a real legal document out of this. We did have eventually a lawyer come and like look at something like this and signed off on it and basically saying like, I understand that proceeding like to receive treatment, even though, it's not in their specialty, blah, 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 they will try to the best of their ability to provide care. Like basically, this is my only option. I have done that for so many patients where we had them sign this thing basically because they literally could not afford to go like anywhere else. Sometimes it was okay. Sometimes it like wasn't. And it was the ones that wasn't that made me quit because I was like, I mean, you're stuck between a rock and a hard place, right? Because you're like, am I going to treat someone who like this is beyond what I can do, right? A huge thing about working in healthcare is knowing what you know and then knowing what you don't know. And sometimes when like you were kind of like, well, like I don't really know this, but if I don't treat you, you have nowhere to go, right? Like you don't have anywhere that you can go. And so that yikes situation. So we had them sign it and went from there. But it did make me feel better that we had those signed because yikes. Sandy Boffa, thank you for the super sticker. That's very kind. This is exactly how I feel. I feel like an angry rhino charging. That's exactly how I feel. Said that's amazing idea on your part. We deal with all of that all the time. My PCPs are managing complex, crazy diagnoses as best as we can. Yep. As long as you can explain to people, right? Like, hey, this is kind of beyond my wheelhouse. I would love for you to be able to go somewhere else. I get that you can't. Let's try to figure it out. And that's when you also start using your network, right? You're calling all sorts of people with all the time you have, right? Because you're not like craving through people. All the time you have, you're calling all the other people being like, have you ever done this? Please send help. Chet says, Liz, please give Nina my contact info. I don't know how to get a hold of Nina. Nina, if you want to email me here, I can give you Chad's email. Where'd it go? Nina, email me here. Boop. I'm assuming this is about pain medicine in clinics. It really was phone a friend. It was very much the approach that we had. I was like, oh my gosh, please help. Please help. There we go. There's my email, Nina. If you would like to email me, I will connect you with Mr. Midwife and you guys can talk about giving people pain medicine. People pain medicine who need it. Okay. How do that's what we've got there. I'm trying to go back. Oh, I deleted the wrong thing. Sandy, I just deleted your message on accident. J. Michael, I'm just taking that out because I don't want it all over the internet. And I accidentally, there we go. Oh, here I found it. I realized help was not coming on the XR amp. Yeah. There we go. Yes, I just found out about, Leslie says, I just found out about Amazon entering the healthcare. I find it scary, but also take it if I can't afford medicine, unfortunately, for sure. And that's what I think it is going to be great for us, filling that much needed hole where people can't afford it and then stop taking it. Then come back and have a stroke. I'm like, well, that's not ideal. We don't love this. We would love a different solution. So if you ever see anything, that's going about healthcare change, if you want to be, if you want to go change the world and go get involved in politics, go fight that fight. Go fight that fight. You can do it. You got this. We can do this. We can figure it out. We're going to be fine. All right. I'm going to go. I'm almost done crocheting my sweater, friends. I'll show you my sweater when it's all done being crocheted. It's the first garment I've ever crocheted. Very proud. Had to go back. I've ripped it out so many times because I got very, very good night, J. Michael. Hope you feel better. Everyone send good J. Michael good vibes. He's stuck in the hospital. Not feeling so hot. So go. But where was I saying? Oh yeah. I crocheted almost all of a sweater. Had to rip it out so many times. Stupid, naive me over Christmas was like, I'm going to knock this out of the park, like over Christmas break, over 1 week when I was at my parents' house. You foolish, sweet summer child. I spent so much more time, but it was because I've never done something like that. So I kept making like stupid little mistakes. And then I realized, so like with crocheting, your tension, like depending on how stressed you are, is how much you pull on, on the string. And I would get really, really stressed. And then it was getting narrower because I was watching YouTube channels that were making me like stressed out and angry. So like my sweater was getting like smaller and smaller. I was like, this is not ideal. So I'm going to go try to be zen, maybe listen to some like relaxing ASMR channels and finish up the sweater. Thanks for being here. Thanks for going on my tangents with me. I don't know if we're going to have a panel discussion this Friday. I think we're probably not, in case you follow that. Usually on Fridays, we have like a whole panel discussion. I think I just need to take like a day off, a day off. And as you can see, we're in a weird brain space. I might make an update on mental health type stuff. Maybe on Friday, since I feel like I've taken you on that whole journey, and we'll see. I'm trying to just take days off when I feel very stressed instead of abandoning the internet altogether. Because right now in my life, I'm like, I'm going to just like quit everything, quit my job, quit this, quit YouTube, like quit all the things. So we're trying very much to just decide maybe it would be a better idea, Liz, to take a day off and like reevaluate in a week or two. Scott will do a live on Friday and I'll pop into that. There we go. Maybe we'll switch things up. I'm trying to figure out a schedule that's a little bit more sustainable. So I'm not sure we'll have lives every Friday, maybe every other. We'll see. It's been a rough week and it's only Tuesday. Yeah, it's been a weird year. It's been a weird year. Well, we'll pull my mom and we'll give me a mental health day. Yeah, if you do a live, Scott, I'll pop in and chat. And maybe we'll do like every other Friday on here. And then we can like all, I don't know, hop onto other channels. I think it could be good. And then we'll figure things out. All right, friends. Thanks for being here. Know that you, my friends, you are not alone. If it's also been a week for you and it's only Tuesday, you are not alone. You are more than enough. We're going to tackle this. We're going to get through it, right? We're going to get through it. And you can do hard things. I will leave a link on my community tab. Did you just say quit YouTube? I'm trying not to go nuclear here. We're trying not to go nuclear. Okay. Like I said, quarter life crisis. Everything's going to be fine. We're going to take deep breaths. Try not to let the trolls get you down, man. It can be I'll let you know, Carol, about the time on Friday. Usually I do mine at 3. I don't know. I'll post in my community tab the link to go over to Scott if he's hosting it or whoever's hosting it. That way we can all go chat over there on Friday. And maybe we'll like channel hop. You know what I mean? Give everybody a little bit of a turn on Fridays. We'll see what we're doing. Anyway, thanks for being here. Have a great day, guys. Watch out for the community tab post. I'll see you next time. Bye. Boop. Where's this? Boop.